Hello and welcome to IGPP Expert Talks. I'm Heena Goswami, Editorial Consultant with IGPP, Institute for Governance, Policies and Politics, New Delhi. India has been making efforts towards universal health coverage since before independence. We had the Employees State Insurance Scheme, the most comprehensive social health insurance scheme ever in the country, launched right after independence in 1948. However, 75 years since then, India continues to struggle in providing universal health coverage to its entire population. To discuss universal health coverage and India's efforts to materialize the vision of good health for all, we are joined by Mr. Amit Paliwal. Mr. Paliwal is Project Director, Indo-German Universal Health Coverage Project with GIZ. He holds technical expertise in various aspects of public health, social health insurance, and hospital management. Welcome to IGVP Expert Talk, sir.
Good afternoon, Henna. It's a pleasure to be here.
Sir, how do you assess India's journey towards universal health coverage?
By and large, universal health coverage globally is a journey. It's a never-ending journey. So I mean, I can't see any country which has kind of attained universal health coverage. We are all on the path at various stages. And if you ask me, India in the last 70, 75 odd years has been making steady progress. Of course, we have had our challenges both on the economic front, on the population growth front, infrastructure issues, but uh, if I look at it, I think over the last 75 years, there have been some major reforms. Most of them are aligned with the idea of UHC. So if I start with the Bohr Committee in the 1950s, where the scheme that you were alluding to, the employee state insurance scheme, it kind of the genesis is with the Bohr Committee. That's where the whole idea of a state-funded health insurance scheme with contributions from the participants or the beneficiaries was initially envisaged. So the ESIC started around that time. Then we had other health reforms. A lot of disease control programs were brought in to kind of strengthen the primary and the promotive care. Um, uh, we steadily made progress till around 1990s when there was the liberalization, and that's when I think the whole idea of a more of having to invest more in health came up. So it was, if I can remember correctly, in the Manmohan Singh government that for the first time India committed to 3% of its GDP to be spent on health. Unfortunately, we have not still reached that stage, and that primarily one of the reasons is because our GDP has been steadily growing, so the 3% grows along with it. Uh, but So that's when the Rural Health Mission, as it was initially called, was envisaged. A very radical program at kind of strengthening the capacities within the public health system, especially at the primary care and the secondary care level, creating efficiencies, also looking at innovative practices that was brought in, had a good impact. But of course, when we look at it in retrospect, we realize that we had major absorptive capacity issues. So the system was not able to absorb the additional flow of money into the health systems. Then I think that went on for a while, and around I think 2000, 2005, we had the National Health Policy, 2002, if I remember correctly, and which said that there should be government funded health insurance schemes in India. That's, I think, the genesis of the Rashtriya Swasthya Bima Yojana, which was brought in by the Ministry of Labor, which I would say was the first real attempt at large scale health insurance for the poor. And it had its own successes and challenges, I would say. But overall, I think the idea started gaining traction. And if you ask me, I think the biggest change which has come in the last 20 years because of such ideas is that today health insurance is a political election agenda point. There are governments, I won't like to name them, who want to one up on the other to kind of propose a better health insurance scheme for their states. And this overall, I think, is a step in the right direction. So from Rashtriya Swasthya Bima Yojana, eventually in the current government, we had the National Health Policy, I think 2017, and that's where the whole idea of Ayushman Bharat came in. And we now have the Pradhan Mantri Jan Arogya Yojana. So, I mean, if you look at the trajectory, it has been upwards. It has been upwards, steady and slow, I would say at times, but there has been steady progress, and there have been progress in the right direction. Just to quickly share a data is that, if I go by the National Family Health Survey 4 and National Family Health Survey 5, you would see that there's been an increase of around 11 percentage points in the total coverage under health insurance. So it was 29 odd percent in NFHS 4, and it's 41% in NFHS 5. And when you combine that with the increase in population, because steadily our population is also increasing, so that I think overall, we have been statistically and also socio-politically making good progress. There are huge inequalities which I think are there ever since independence. The southern states tend to do better than the northern states. Then there is this whole question of how to deal with the missing middle. So the middle class, which is just above the poverty line but not rich enough to afford their own health insurance, how to cover them. So those are still big issues which are there, big challenges. But I think overall, if you ask me, Hina, we are moving in the right direction, slower than we would like to, but still I would be optimistic.
In this slow progress that we are making, what are the major hindrances? What do you think have been some of the biggest challenges in our journey towards universal health coverage?
Good. So, Hina, I mean, if I can divide the challenges, see, there are certain global challenges which are there everywhere. So there is this whole fiscal space issue. Where will the money come from? So there is this whole challenge about the fiscal space, which I think is a global challenge. But then there are certain challenges which are very specific to our country structure. If I can broadly divide them, I would say there are three challenges. There is the whole issue about the fiscal space. Then there are certain systemic approaches where I think, uh, maybe we could have done things better earlier. Maybe we could have had slightly different approaches. And then there are again certain generic issues which have been there by and large globally, and things like lack of human resources. I'll just kind of elaborate each of them for you. So when I'm talking about fiscal space, there are two parts to it. One is how much money are you generating, and most of the money is generated through taxes in India. And if you look at the Indian tax structure, I think bulk of the taxation is indirect taxes. So increasing taxes has its own um, negative impact on the lower middle classes, because indirect taxes mean that they get disproportionately affected. That's one challenge. Then the challenge again is that within that limited budget, how much are you able to allocate for health and for health insurance, because they're competing priorities. There's food, there's nutrition, there's early childhood, there's Manrega, rural employment guarantee schemes there, and then a lot of other social sector schemes which come in. So the government is always pressed to find money for health. With whatever money we have, then the whole aspect of utilization comes in. How efficiently are we able to utilize the money that we have? And that's again where, as I explained earlier, we had our inefficiencies in the system. For example, even now, I don't think we have a very good uh, provider payment mechanism in place. How to buy services, for example, if the government wants to be the biggest buyer of services, which it currently is, because if you look at PMJ, it's the world's largest health insurance scheme, which makes the government the largest purchaser of healthcare as well. So, but I wouldn't say that our systems are efficient. I think there's still a long way to go when it comes to purchasing healthcare. Coming to the second one, the systemic approaches, I think there are again two or three parts to it. The first is the government part of it. So from independence onwards till almost now, I would say we've basically been in a vertically disease control program mode. So we've had uh, missions for vertical disease, for diseases. So you have something for TB, you have something for malaria, you have something for maternal child health. You have these 21 odd vertical programs which are running. There's not been a systems approach right from the start. For example, I mean, just anecdotal, you go to a lab in a district, you will find four microscopes, one for TB, one for malaria, one for malaria. It doesn't make sense. That's not an efficient use of resources. But that's the way our systems have been driven. And this is not only in equipment, it's also in manpower. So you'll have 4 lab technicians, one for each vertical program, which again is an inefficient use of resources. Then there is this whole public private heterogeneous mix of providers. And there's never been any efficient interface between the two. For 70 years, we've been struggling to come up with meaningful partnerships with the private sector. There have been few examples, but nothing systemic as such. And unless we can rope in the private sector, which currently is providing almost 70% of our healthcare, there is no way we can go up to universalization. And third, as I said, there are certain generic global problems. For example, lack of human resources. It's a global issue. It's not in India. I mean, obviously countries like India and Philippines, we are worse off because there's a lot of brain drain. We create a lot of intelligent doctors, nurses, paramedics, and then they tend to find better lucrative jobs abroad, and then they end up there. The whole infrastructure issue, even 75 years, our population has been growing at steadily. It's difficult to keep up with the infrastructure. So by the time we are ready for a billion, we are 1.3 billion. By the time we are ready for 1.3 billion, most probably will be 1.5 billion. So, we are always in a catch up mode as a developing country. And then there are certain debatable issues like health technology assessment. What technology is best for a country like India? What kind of equipments, what kind of medications should we use? The whole talk about uh, generics versus branded medications, and the whole intellectual property rights challenges. So those are certain other issues which other also complicate the matter. So overall, I think, if I look at barriers, these would be the three barriers. There's the money part, and then there's the structural part. um, so that's how I would like to summarize the challenges.
What do you view can the government do, like the small efforts, small changes that government can do to tackle these challenges that you just
Mhm.
mentioned?
Interesting again. So, I mean, if you ask me, the government has been in the right direction, right from independence. If I look at the Boer Committee, which I think came up in the 1950s. So, the government has been in the right direction, and they have been making steady and slow progress. If I look at the way our healthcare system has evolved, so I think the building blocks laid down by the Board Committee made a lot of sense in creating a very good ecosystem for preventive and promotive care. Making sure that there is a village level frontline worker, which I think was, if I can say, a master stroke at that time, because countries still struggle with frontline workers, and we had one envisaged way back in 1950s. We've obviously made more progress on that now. We have much more presence in the field, but the idea was there right from the word go. So the board committee led to ESIC, as I said. Now, ESIC, the challenge was that ESIC is limited to formal sector workers, for workers who would be working in organizations with more than 20 employees. Unfortunately, more than 95% of our workforce is unorganized in India. So that leaves a large chunk out of it. And at that time, given the technology and everything, it was very difficult to make a participatory health insurance scheme with informal workers, because the cost of collection of premium would be higher than the premium itself, kind of, for example. We ended up making a lot of progress, and as I said, in the 1990s, when liberalization set in, and India started comparing itself with the global south, global north, sorry. Uh, we we realized that we are spending very little on health. I think at that time we were hovering around 1.1% of GDP, and we at that time made an ambitious target of 3% of GDP, and that's where I think the whole idea of using other modes of engaging providers came in. So there was a lot of focus on public private partnerships and other innovations as well. A lot of employment of contractual workforce to strengthen the public health system, and also to outsource certain agencies. So, and once that was established, I think the ground was set uh, for launch of the government health insurance scheme, or RSPY as it was called. So I think the government has been doing its bit, if you ask me. If you are also on the fiscal space, if we look at things, the whole idea of bringing in digital payments, I believe will increase tax collections, but then again, we have to see, is it adversely impacting the lower socioeconomic classes? Because any taxation based on consumption will in disproportionately affect the lower middle income groups, because the consumptions as a percentage of your total income will be lower in higher income groups, and the percentage will be higher in this lower income groups, so they will end up paying a larger percentage of their income as taxes. So somewhere the whole taxation system has to be stabilized, and also I think the whole challenge about, uh, I would say, a sense of mistrust between the government and the private sector. And I see, because I've worked on both the sides, I see it is there equally on both the sides, though each side feels it's higher on the other. So that's there. Then there are certain challenges which I think are difficult to overcome the whole federal structure of India. For example, health is a state subject. It's not a part of the concurrent list as per constitution. So each state can have its own set of modalities for implementing, and when that happens, you see the divide between the north and the south. So we have districts in certain states in India which are worse off than sub-Saharan Africa, and we have certain districts which are better off than most European countries in terms of indicators. So we have that mix, and partly it can be attributed to the federal structure that we are staying in. So summarizing it, I think uh, the government has been moving in the right direction, not as fast as we would wish for. I think there are implementation issues, which I think is not limited to the health sector. I think it's cross-cutting. We know that there have been inefficiencies in our delivery mechanisms for almost all social security schemes, not only for health insurance. Um, I mean, it's a glass half full, if you ask me. We are moving in the right direction, not fast enough. So that's where we
So you mentioned the interface of private and public sector in healthcare as one of
are.
the challenges. How do you rate the role that private health sector has played in India's journey towards universal health coverage? And how can it be made to contribute better going forward?
Hmm. So the private sector, I mean, we can't discount the fact that private sector is the first point of contact for more than 80% of our population, and almost 70% of our healthcare is being provided by the private sector. I mean, there are various data sets you can allude to, but by and large, eventually you will find that a majority of our healthcare, and by majority I mean way in excess of 50%, is being provided by the private healthcare sector. So without engaging them, it is by and large impossible to reach the dream of universal health coverage. So obviously, private sector has a very, very important role. Now, having stated that, I think it's a two-way road. When we're talking about the government and the private sector, it has to be a two-way road. Both of them have to arrive at a middle path and kind of converge on certain ideas. So if I look at it from the private sector, what they can contribute is innovations. For example, they can come up with certain very cost-effective tools, mechanisms. For example, telemedicine is something which we have all heard of. During the COVID time, the whole hub and spoke model of intensive care became very popular. The whole aspect of health technology assessment is something where I think the private sector can really take the lead, because they have the pockets to experiment with various technologies. One thing which I think the private sector must think of is self-regulation, because if the private sector does not regulate itself, then somebody else will regulate them, and that's where the conflicts will arise. So it's always better to have self-regulation than to force somebody else to intervene. Third aspect is the whole quality of service part. I think the quality of service in private healthcare is perceived to be no doubt better than the public healthcare. I think there are various surveys to prove that the general perception is that private providers are better than government when it comes to quality of care. But then within the private sector, there is a huge disparity. There's a lot of lack of regulation and malpractice which happens there. So I think those are certain aspects where the private sector can kind of introspect and work and strengthen its role. From a government side, I think again, it's very important that when you're engaging with the private sector, you have very robust costing mechanisms based on which you can purchase services. As I said, over the last 70 years, we've still not had enough data to be able to come up with you know good costed packages for various illnesses. So the whole provider payment mechanism, I think that needs to be strengthened, and a part of that would be costing. Another part would be claim settlement. So the whole aspect of settling claims in time, because if there are delays in settlement, it's an additional cost to the private sector. So we need to find ways where we can kind of make this whole association more lucrative for the private sector, but at the same time we don't end up going bust. We should not increase the cost of care so much that uh, the government is no longer able to afford it. So as I said, a lot of uh, so some sense of accountability has to be brought in both the private sector and the government sector. By government sector, I'm saying that the government sector is also accountable to the private sector when you're engaging in a partnership. So they also have to abide by a set of rules, by a set of guidelines, by some turnaround times, by some set of standards for payments and other things. At the same time, I think that the private sector needs to be open to work with the government in a slightly more altruistic manner, not completely driven by profits. So those are aspects where I think the two parties need to come together. It's a partnership we can't do without. So we have to ensure that this is kind of conceptualized and implemented, and for that I think both parties need to work towards each other.
In 2005, when the government launched the National Rural Health Mission, the
Mhm.
focus was on primary health care. But as we talked about that, now we are talking more about insurance schemes, and now even on electoral agenda, insurance figures more prominently, right? Insurance-based tertiary care. How do we prioritize primary healthcare, especially disease prevention and health promotion, within the ambit of universal health coverage? And does it need to be a priority?
Absolutely. I mean, I think that's a very very relevant question, especially in today's day and age. I mean, I can cite that there are certain states, both in the north and the south, where the fiscal budgets are bursting at the seams. They are not able to afford the expenses under Pradhan Mantri Jan Arogya Yojana. The utilization is higher than expected, and of course we cannot keep increasing the health budget. As I said, it's not something which can go on forever. So we have to find efficiencies. Now there are two kinds of efficiencies. One is obviously efficiency in giving care at the secondary and tertiary level. So obviously those can be made slightly more efficient. Generally services provided by public sector tend to be cheaper than private sector, so there could be a slightly more focus on, for high end surgeries, elective surgeries, maybe public sector could be kind of given a look. However, the whole idea of, a stitch in time saves nine, I think we cannot go beyond that as of now. So as we have to focus on it, it's imperative that the primary and promotive healthcare is kind of uh, it synchronizes very well with the secondary and tertiary healthcare right now. So I mean, if you look at it again, unfortunately I have to repeat myself, the government is in the right direction, but again too slow. So the whole idea of Ayushman Bharat, which was I think in 2014 or 2018, sometime around that time, it was launched by the current Prime Minister, Mr. Modi. It envisages four pillars. One of the pillars is health and wellness centers. So the whole focus on primary and promotive care is there as a part of that strategy. The other three pillars being health insurance, digital health ecosystem, and health infrastructure. So, I mean, it's a very coherent strategy. Ayushman Bharat is a very coherent strategy. But again, it comes in 2014. We are 9 years into it. We right now have 176,000 health and wellness centers. But they, for example, do not. I won't say do not, but the linkage with Pradhan Mantri Jan Arogya Yojana is still not very efficient. I think there are major areas for improvement in that aspect. So what will that do is that we'll be able to create a continuum of care. A patient goes to a primary healthcare setup, is kind of diagnosed and referred to as per need, and then the downward referral is also taken care of. That's very important, because you don't want a lot of post operative care to be done at secondary level. You don't want a lot of pre operative care to be done at the secondary level. That will reduce your cost on secondary care. So if we can strengthen the primary and promotive structures, it's extremely important. As you asked me, is it important? I think it is fundamental to the success of universal health coverage, because no government, no country can afford to only work on secondary and tertiary healthcare, because then your costs will be through the roof. It will be major part of your GDP, and you will not be able to afford it. So to be able to keep the costs realistically under control, primary and preventive healthcare is extremely important. Another aspect, which is not completely monetary in nature, is the whole quality of life. So I think the more we are able to avoid uh, secondary and tertiary care treatment, the better is the quality of life overall. So I think both from a quality of life perspective and from a financial feasibility perspective, strengthening primary and promotive healthcare is imperative. Again, government is in the right direction, but maybe they can be a little faster.
Thank you so much for joining us today and giving your valuable opinion.